Good evening, friends. So, results of INI SS exam 2024 first session, that's the main session, are out. And I think a few of the interviews are already live. So, we are a little late, but we have special is a word I think very cliche we use every time. But this time around, I think it really does mean what it stands for. I think before this interview, all of you should be watching an interview done in 2020 May. It's around the same time by Dr. Rohan, I guess, right? Dr. Rohan did the interview with you, or Abbas sir. Who did the
No,
interview?
sir. It was online. I just gave the interview
Interview,
without
yeah. So
anyone.
you can see that in our own channel. And you can see a girl from Guntur in Andhra Pradesh. She had scored first rank for the INI exam, that is your PG entrance exam. That was not called INI those times. So she came first in AIMS, and you can see that interview. And now, exactly 4 years later, the same person you can see now for the INI SS exam interview. And I'm so glad that her journey started off with been AIMS and then gone to PGI and again in PGI, and directly and indirectly we've been part of that. And I have myself been part of that. All those been on stage or offline, we have never had a class or have never actually discussed any medicine with her. But through the app, that's the beauty or greatness of this format of learning. She has been actually we have been able to help her in some way or the other. So it's actually a moment of great pride, not just in terms of the volume of the rank or anything, but the person she is. No, she is like a person who I understand is a very humble, down to earth person who has, through her own hard work over these years, now 10 years, I think, since she has joined MBBS, through these 10 years, struggled and slogged and toiled and come her way up to a point where she now stands as the rheumatology resident in the top center in the country. PGI is among the top centers in the country. So let's like slowly making your mark over a period of say 10 years, not taking into account the effort that she would have put during her school years, but just purely from MBBS I'm talking. So extremely glad and proud to actually welcome Vineetha to the show. Wonderful chatting with you, and I think it's a great honor for all of us.
Thank you, sir. Thank you so much.
I think before we discuss about rheumatology and all that, I just want to ask you about your schooling. Or what kind of schooling did you have, and what do your where are you basically from, and what do your parents do, and what kind of basic upbringing you've had with respect to you going into medicine after your 12th.
Yes, sir. So I am from Guntur, Andhra Pradesh. My parents, my mother is working currently in State Fisheries Department of AP as a deputy director. And my father has retired. He was working as a principal of Chalapati College and also a chemistry lecturer. So my schooling was in Loyola Public School, Nallapadu. Since childhood, my parents were always keen towards discipline more than anything else. So that kind of reflected in my academic career also. So always whatever starts has to be completed according to a fixed routine or a schedule, or you have to be committed till you get the result. That's what I've been getting all through my academic career. So after completing my 10th in Loyola Public School, I did my 11th and 12th in Sri Chaitanya College in Guntur itself. Then I joined MBBS in AIMS Bhubaneswar I'm 2014 batch. Uh, then after completing my MBBS, just after the internship, I got rank 45. I could have taken pediatrics in PGI, but again, there are some decisions since I started my MBBS career which were very tough, and I had to take them just to follow my passion. So always I loved medicine, and I wanted to get into internal medicine. So I prepared again and joined in June 2020 in PGI Chandigarh, internal medicine. So I completed in last 2023 June. Then since then, I was preparing for specialty exam. Initially, I was not very clear about what specialty to choose, because that's the problem, I guess, with everyone who loves medicine. Even my friends had, some of them had very great difficulty, because we want to stick to medicine and we don't want to deviate into one particular specialty. So initially, I gave hematology in the first INISS after my PG. Then I decided that practically I better fit into rheumatology, and it can also serve the purpose of continuing with medicine also. So then I started preparing for rheumatology around August, September of last year. And last year was my first attempt, November 2023, and this is my second attempt.
Wow. So before we actually dwell into how you prepared and how you study, let me just ask you the same question. Like, it's been 10 years since you have joined MBBS. So you've actually completed a decade. You're coming from Gundur, which, for the knowledge of our, so, I mean, viewers, is a district en route Chennai to Vijayawada. So it's in that route. It's in Andhra Pradesh. Nellore, Gundur, Vijayawada. That's how we go. So coming from a city like Gundur and doing schooling from a pretty decent school, and then of course having parents who are very well educated and supportive. You've been actually studying outside Andhra Pradesh. All your courses are outside Andhra Pradesh, and now you're actually doing your second course in PGI. How do you feel? Is there are so many girls? The majority of the students joining MBBS now, 72% are actually speaking girls. So many of them would actually love to be in your place. They'll be actually looking you as like some role model or somebody whom they really want to look up to in life. Okay. So that way, what do you feel? Is it actually very tough, or is it achievable? What do you think are the success mantras for this? Is it just hard work, or discipline, or natural ability? How will you actually mix all these things and say what all are required in proportion, if you want to put it that way?
So I would say if somebody is able to do it, then we can also do it. That's what I believe. So when I was studying in 12th class, I also thought AIMS is a big thing. Maybe it's not for me. I used to think like that. It's in Delhi. We are in South India. It's almost across the country. So it's nothing like that. If you have in mind that you want to do something, and you have to have some role models or inspiration of people who have already done it, and you also have to have passion to do it, and you have to have a strong reason why you want to do it.
Exactly.
For me, that was because I was so much interested in medicine, so I had to get into the best college. So that's what was on my mind. So it is possible if we think we can do it, and the first step towards success is we should think, yes, I can do it.
Wow, great. Many of the students have actually slogged hard like you to get into MBBS and thereafter into PG. But as most of the people watching are PG students, let me ask you a question that they have themselves asked. Like, before they enter into the subject, they have so much of expectation and they struggle very hard and they get a rank in sometimes Central Institute or sometimes peripheral colleges. They take a seat. Did the course at PJ really meet your expectations? Or was it above or below your expectation? You had an expectation going into a PG course, right? Was it like exactly along the lines of your expectation? And when it was not, how did you try to overcome that? Or how was that part about?
So PGI medicine was definitely it definitely met my expectations, because what I expected was I have to learn from treating patients more than from reading books. So
Yeah,
that was definitely there. Uh, the thing about medicine is one small mistake can cost life. So we have to be very sure of what we are doing, and that cannot be from just hard work. And if you keep on reading a book for 30 days or for 1 year, still you may not be a good doctor. So for that, I believe you have to have a high volume center where you have to do on your own, learn from your mistakes. And it is challenging. I wouldn't say PGI had met my expectations all way through. There were challenges, but at the same time, those challenges are what made me grow and become what I am today.
very good.
It gave me the
So
confidence.
my question is like physically how much demanding it was, because how much duties you are having and running around and doing this work, not able to sleep adequately. So many people actually talk about the mental trauma. Maybe I feel more about the physical side. Physically, like how did you feel? Were you like fatigued and exhausted many times? Do you feel like physically we need to be more fit to do this kind of a course now?
Yeah, definitely. Physically, it is very demanding, especially those 3 years of residency. I think we should be physically as well as mentally fit to survive through those 3 years. Sometimes it will be like the legs are very sore. I just want to go and lie down on the bed, don't want to do anything else when we come back from the duty. But that's worth it in the end, I feel.
Exactly. And again, many of the students who work in peripheral centers, etc., are trying to somehow complete the syllabus by reading, reading, reading. I have myself understood that beyond MBBS, there is no point in reading anything, and I am not a fan of reading, as I've said so many times. what is your take on that? How much of reading is actually required, or is reading the way to go forward? Apart from reading for the exam, which everybody has to read, but as a routine medicine person, you are a medicine physician, then you become a postgraduate in the super specialty. Is reading actually a part of your? Is it, how important is it to read?
Reading is important, but what is more important is whether we are able to apply what we have read. Most of the time, what happens is we read a lot of things, but when we don't apply all those things, we only retain what we are seeing in the daily routine or daily OPD or whatever patients we are treating daily. Only that much we are able to remember. So
Yes,
I don't know what is the point of reading so much, but at some point, you have to have that knowledge to apply. So you cannot treat a patient without having the knowledge, but knowledge alone again is not sufficient to treat a patient. I would
exactly.
say there should be a good balance between both.
Balance. It is in that context that I want to ask you this question, because you have been following Marrow from your MBBS onwards, and you've been seeing these videos, medicine videos, rheumatology videos from MBBS onwards, and now it's a long time. So through these kind of courses that you have done, how have you been able to, what it says, get in sync with these videos, or how have they helped you to build the medicine inside you? Or from a very raw level, that means when you're doing MBBS where we don't know anything, and I think like you were in a college which is in a upcoming level, it's not like a very well established college, it's a college which is upcoming. So at that point to now, how have they been helpful in your journey across?
So Marrow, especially medicine videos that you have done, sir, I think they are the most helpful resource that I had since my internship days. Because the way you integrate the topics from physiology to medicine, from surgery to pathology to medicine, that is what is actually required to retain the things in the brain. When we integrate the things, the connections form better, and we can understand in a better way, and we can finally apply it when it is actually needed. And now also in rheumatology, uh, like I would say, sometimes when you are continuously reading, especially while preparing for exams, I think boredom is something which comes naturally when you keep on reading a book. So I think learning in different ways helps. Like watch video, read the same topic, do some questions. So that's what helps actually when you learn the same thing in different ways. It reinforces the concepts.
Yeah. Now, this question, which is again a very cliche question, but you have to ask this. Sticking with medicine or going forward, definitely you would have had your doubts, especially being from PGI. How did you try to overcome those doubts, and when did you come to a serious plan? And why you chose rheumatology? You said that it has got everything to do with medicine, it is a continuation, but still, we can talk about rheumatology with respect to its pros and cons. I think I have myself tried to glorify rheumatology during the videos, and I think there is now a lot of fan following per se for rheumatology. But everything said and done, rheumatology is not a subject where you can prosper like an interventional specialty. It is basically a physician specialty only. So that way, seeing how did you actually kind of zero down to this rheumatology from like so many options that you have had?
So first thing, specialty or no specialty, in that, if I have to stick with internal medicine, it's a lovely subject and I will enjoy it. But looking at the practicality of it, it is a ever evolving subject. To keep up with so many things that are evolving in every specialty is close to impossible when you have other things to do in life. Like you can't just spend the whole life reading. You also have to give some importance to personal life too.
Yeah.
So that's where I decided, okay, we'll just excel in one specialty and then treat the rest of the medicine, whichever is possible to whatever extent possible. So then coming down to which specialty. So initially I thought I would want to do hematology, but then hematology is again a very intense branch.
Yeah,
So
very
taking
interesting.
back that emotions and all that burden, tension, stress back to home again brings a lot of stress. That is not true for every person, but I am that kind of person. That's what I understood while working in hematology. So I thought practically I better fit in rheumatology. And why rheumatology?
Rheumatology also, I think, has a lot of emotions to take home. Rheumatology is not anywhere better. I don't feel that way, because rheumatology problems, as you know, are ailments where we are not trying to cure most of the time. So most of the time, it's like a lost battle only. But as you said, emotions are different, because when you hear leukemia, that kind of fear is not generated by something like SLE. But in reality, SLE is worse. But
Mm.
that's how we perceive it. It's okay, fine. So
So, like the way I see it is, rheumatology also has bad diseases and chronic diseases, but at least we are able to treat it, and patients are able to get the treatment. In
yeah,
hematology, treatment has become very costly,
exactly.
and that also becomes a main factor.
Very good. Yeah.
It feels like helpless sometimes.
Exactly. How have you been influenced by the rheumatology department at PJ or the medicine department at PJ with respect to rheumatology? Any names you want to mention as to before you set out to take the subject, people whom you saw there who you felt were really inspiring with respect to rheumatology per se?
So my first rheumatology exposure was in second year of PG when I had rheumatology posting. At that time, I really liked the subject because it is like the whole of medicine in one specialty. We are integrating all the systems. We get neurology cases and we get gastroenterology cases,
Yeah,
hematology. Everything is in one place.
yeah,
So
correct.
that is what attracted me. And to tell my inspiration, I think PGI faculty is have been a great support to me, and the department is very like friendly, and they inspired me to take up the subject when even when I was having confusion between hematology and rheumatology. They were very supportive and guided me in the right direction.
Wow, that's nice. And regarding the other doubt, which many of these students have, no, because we have a lot of rheumatology seats inside our NEET as exam, which has medicine as a syllabus. And when we try for INI rheumatology, then we have hardly very few seats. And for that, we have to study rheumatology in depth. You had a very easy option of just preparing for NEET as exam, studying only medicine, nothing much more. And you could still get a very decent rheumatology seat at Nizam or at Madras Medical College or at CMC Vellore or at TPJ, which are all premier institutes. But you went the hard way, the real hard way of taking Kelly and sitting and reading Kelly. So that is not something which a normal person would do. He would always take the easier route. Why did you take this hard route and not go for a very simple, chill out, easy route on the other side?
One thing is, I wanted to do my specialty also in PGI itself. That was
Yeah,
at the
that's
back
what
of
I was
my
asking
mind.
you. What is the reason for that? What is the reason? I know that very specifically, because if you wanted to do rheumatology, then you are having multiple options. And I know personally Nizam department, which is a fantastic department, and that's in your state or nearby. You are having Chennai Madras Medical College. So, what made you think? Generally, when we do a PG course in one center, we want to run away from that center. No, next course we want to do somewhere else. You wouldn't have actually, I think, preferred Bhubaneswar itself for your PG course after doing MBBS. So after one course, everybody's natural tendency is to change the college and shift, mostly preferably shift to near home, especially having been so far for so many years. So in spite of that general tendency, what makes you stick to PJ? That's what I think students will be interested in knowing. That should be pumping them to give their 100% for PJ. What is that special factor?
So my rheumatology posting were one of the best postings, and I like the department very much. It was very comfortable working in that department. Like everyone learns together, and they're ready to teach. And if we make any mistakes, so that is one thing. And one more thing is NEET. Almost every college has bond
Yeah,
period.
very
So that was something which was not. I was thinking it's not worth it. Maybe.
yeah, it's true. That's definitely true. And stipend is another factor, bond is another factor. So there are factors like that. But essentially, I think what I feel personally is that you will be, after coming back from PGI at the end of your DM, finding it a little bit more difficult than a localite to get acclimatized, because you have not studied anything over here. Once you come back to Gundu, you may be taking that extra time, to just get the balance straight. Which, in contrast to somebody who has studied here, he might be finding it a little easier. But I think that's just a matter of 6 months to 1 year. In that time, you will be able to. So you have been a very ardent reader, no, from the days of your MBBS. So I think Kelly reading wouldn't be much of a problem. But still, many of us here feel like students find very hard to read Kelly. Kelly is not a simple book to read. It's like a Bible of rheumatology. It's like a humongous book. So how did you tackle that mental thought process of having to read Kelly, or you're very comfortable reading that?
The Kelly, I think it is a easily written book. As far as the clinical features and treatment
Yeah,
part is concerned, that is easily understandable. So I used to start with the part which I can understand easily. So usually the clinical features and the treatment part. Then I go through the guidelines to get a better understanding of the treatment. Then I'll do the questions and just concentrate on that part of pathophysiology which is important.
That's it. Okay. So if you take a student who doesn't have time to read Kelly, okay, and is actually just following the videos, will that suffice for him, or is it mandatory to read?
Some questions which may be deciding do come from Kelly or sometimes even Hochberg. Like this,
Yeah.
this exam had some questions from Hochberg, one or two
Okay.
questions. So those I could not answer. So those questions might be deciding, or maybe everyone won't know that we never know. So
Exactly.
except for those questions, most of the part videos are covering it. I think after videos, if we do the questions, I think most of it is covered.
Yeah. So that is something which we often try to address, because the fear that students have is to read this book, because reading this book is not an easy task. It is a Herculean task. Hochberg is much more easier to read, and most of the videos are actually made from the new videos are made from Hochberg only, because Hochberg released last year and Kelly is like a little old. So the videos are made from Hochberg only. So essentially, what I've understood is reading is something which comes to certain people very naturally. So they don't find it tough reading. Certain others are not very pro reading, so those guys can actually use the videos better. Now, in that context, the practicing questions, you already cracked your UG exam, PG exam, so you are almost always in tune with MCQs. You have proven that earlier also. How important it is to practice MCQs? Is it more important to learn or more important to practice at a DM level?
It is more important to learn definitely, but since we are doing MCQ questions, when it comes to doing the exam, I think it is important to practice because when we keep on reading so many things,
Yeah.
some things get missed out from the memory. So those
Yeah.
things get reinforced when we do questions. That's
Okay.
it. Otherwise, I
And
think learning is
otherwise, it's the same. Another question which most of the students want to ask is they find very hard learning immunology as it has been through the years. And I have myself not understood why we are studying so much of immunology yet. So when you try for NEET, even if you skip immunology and go also, nothing will happen because you get one question from primary immunodeficiencies, that's it. But when you're preparing for I think then you have to read immunology thoroughly. So what is your success mantra for immunology? Because many people are afraid of immunology. How to tackle immunology?
this time, the paper, whatever the questions from immunology, I think most of them could be answered from reading Harrison Immunology itself.
Okay.
I read the basic chapters of QB's immunology, but I think Harrison should be enough for most of the questions.
Okay, fine. And what is your thought process on like kind of mugging up immunology in a very short time before the exam and just going and delivering it and forgetting it and going? Because you study immunology again and again more and more we get confused only because we really have no background idea of these things. Only during DM, during your posting, somebody will understand why this is done or that is done, etc. So is it better off if we just kind of devote very little time and mug up so many things and go? Because representation wise question numbers I feel are much less, right? Percentage wise. So it's like learning something like a concise immunology package more than enough.
Yes. So immunology is again something which is memory based topic. So I think before the exam, around 1 month, if we read the immunology topics, like every week, some topic should be revised. I think that should be enough. Rheumatology proportion is way more than immunology.
And this is again a question which students would love to ask. We just try to rate CTD, vasculitis, arthritis in terms of their weightage for the INI exam. What do you feel would be the most important exam zones as far as the INIs that you have written are concerned?
Um, Vasculitis, I think CTD followed by vasculitis and
And then only
arthritis.
arthritis. Yeah, fine. And as far as CTD learning is concerned, you feel like majority of the questions come in and around SLE. Like SLE has a big representation because people actually keep on reading SLE. I feel like there are people who are like kind of stuck with SLE, not moving away from SLE. So like how much important each of these topics are inside that? What do you feel inside CTDs? The areas where they ask maximum number of questions.
It differs according to paper mostly. This time, most of the questions I felt were on myositis. And
Okay.
those were one liner part based
Yeah.
questions, memory based questions, and science and all.
Yeah.
Uh, Otherwise, usually, I think Scleroderma and myositis are something which are neglected, but those are also quite important part in the
Yeah,
exam. SLE
very
is
true.
always there.
Because I think between Kelly and Hochberg, there is considerable difference between the way they have actually approached scleroderma and myositis. And I myself, when I did the video, explained about the newer angles that have been developed in myositis. Myositis is no more the polymyositis, dermatomyositis. No, there are far, 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 far more numbers. So like the spectrum is just keeping on widening and widening and widening. So now, like this question of what are your dreams with respect to this course now? You've seen the department already, so you'll be having some know-how. But like, what do you think, or where do you place yourself at the end of 3 years of entering into this course?
At the end of 3 years, still I am of the mindset that I'll join a teaching institute. So
Okay.
I should see how that goes over.
Okay, fine. I my 2 cents of advice is like once we come into the real practicing world, the attitude that we have as students in a teaching institute should be actually going for a change because if we try to keep the same attitude or learning attitude, then we should be continuing in such centers because such learning doesn't happen anywhere else. That's the basic that happens only in premier centers, premier institutes, and some state premier medical colleges. Everywhere else, we are having a day-to-day bread and butter practice kind of stuff, which people who have actually spent a lot of time, invested a lot of time in reading and learned the hard way, will find it very tough to get acclimatized to. So if you can actually set up your career in PGI itself, I think that would be the best part. Rather than coming to Gundur and trying to actually set it up here, I think that is definitely going to be a little tougher because institutes always give us that, what is it, as you said, no, the warmth and the learning process is much, much more happier. So in between, you have worked in Jipmer also for a few months. So just kind of take us through that also. That's another institute. So what is your experience and how different it was?
The only reason I worked in Jipmer is to because I had this doubt whether I should continue in medicine or do a specialty. So I just wanted to see how is medicine as such in South. I
Yeah.
wanted to join somewhere in South India because I have always been in North India for the last 10 years.
Okay.
So just to decide whether I have to stay in medicine or do a specialty, I joined.
We actually want to do a course after MD. It's not because we don't love internal medicine. It's not possible to actually stay back and stay updated because the subjects are running away from us. They are just kind of going at rocket speed. And the cardiologist is not the old cardiologist who will actually teach us S1 and S2. He is gone into the era of core intervention. Gastro is something where even the terms that have been used by the gastroenterologist, a normal person doesn't understand. Somebody, a normal person in the sense, somebody who has an MD medicine. How many people know the full form of poem means? I think most MD graduates wouldn't know the full form of poem, which is something which on a routine basis an international gastroenterologist does. So that's how every subject is evolving. Hematology is going into the era of CART. Rheumatology is also going into the era of CART. So obviously, it's not possible for anyone to actually stay back in medicine. We have to pack our bags and start running. So it's in that race that we have actually seen you at this point. I'm very happy. I think your journey is pretty similar to an interview we did last time with Amia. Amia is also he's actually from Orissa and he is now currently hematology resident at AIMS. But like been with Marrow through his MBBS journey and then PG journey and now going into DM. So the PG exam is coming up on the 23rd, and we are having approximately 3 lakh people appearing for that exam. A lot of girls from Andhra Pradesh as well. So, what is your final advice? There are just 20 days or so remaining for the exam. Not even 20 days, 15 days or so. They are all like so much stressed out and like kind of stress from north, south, east, west. So, what is your two pieces of advice, 2 cents advice?
I would say believe in yourself. Whatever you have done so far, you have done your best. Just believe in that. And these last 20 days, you have to prepare with a cool and calm mind without taking any stress or tension. And so that you remember what you have prepared. Uh,
Yeah.
Basic thing about these exams is anxiety levels before the exam. That is what makes the whole scene very bad. So controlling
Yeah.
that is very important.
The last question I want to ask you is if somebody listens to this video from outside, they'll get a feeling that Vineetha is a person who is reading 24. So apart from that, what else you do? Because you have read Kelly, you have read Osborne, you have read Ashton, you've done this, that, etc. Just tell us, apart from the medicine side, what else keeps you engaged? Now you've been actually not in the PG course for about a year, right? So apart from reading, what else you do?
So I sing. So I was learning keyboard for the last
Yeah,
6 months,
wonderful. Yeah.
and I also do yoga,
Nice. So
and
that's
I
how you
also
actually
like to.
remain very composed. Are you always composed like this, or just because like it's an interview, you are very composed? In general, are you a very
In
what do you say?
general, I am composed.
You generally don't raise your temper. Do you actually get into fights during your PG course with colleagues or juniors, or that never happens with you?
I wouldn't say never, but it happened quite a few times. But then mostly I try to be calm.
That's wonderful. That's something which we are, I mean, almost absent, I can say, almost nil at this point because people are having very, very, very low thresholds now to actually start getting on top in plastic. So wonderful discussing with you. So all the best for your future endeavors and very, very happy because last time also for INI we got rank one Bodhi Bharata from Kolkata. So he will be your senior, I think, at PGI. So I think it's wonderful that second time also around we have actually got rank one. So very nice talking to you and all the best wishes from the entire team of Marrow for you.
Thank you, sir. Thank you so much. Special thanks to you for all the videos that you make. It's very inspirational and also very informative.
Okay,
Thank you
thank
so
you.
much.